Thank you, Devin. We are happy to be joined this morning by Nurse Christina Paris. Thanks for coming on this morning.
Glad to be here.
Today we are talking all things respiratory illness, especially fitting given it's cold and flu season. What are the respiratory illnesses affecting us today?
Yeah, so, it's hard to say because there's actually over 200 different types of respiratory illnesses. A lot of what we're seeing, you do have your common colds, but we're also seeing, of course, flu and COVID as well. And so it's tough to know exactly what you have. When we're talking about the flu, for example, there's lots of different strains. And so we talk about, you'll hear maybe H1N1. So the H is a protein, it's hemagglutinin, and there's 1 through 18. So you can see N1 all the way up to N18. So that tells you all the different subtypes that there are. That was H. And then N is the neuraminidase, and that's a protein that identifies the N protein. So that's where we get the H1 and the N1. But it just explains how they identify or classify them. There's really hundreds of different strains in each one of these. And the big ones that we're seeing right now is the H3N2. We saw that again back in 68, 69. It was actually the pandemic during those years. And so we're seeing these come back. And the problem is that we get these vaccines and we try to guess, based on which ones we're seeing in previous years. And so that's what they put into the vaccines. And sometimes they're in there, sometimes they aren't. But these shifts and drifts that we're seeing are such subtle changes. Your body just doesn't know how to react to it. So, you might have a star with 5 points and your antibodies, those are your fighters in your body, might look at that and go, oh, we know that guy, that's a bad guy. But then the next year it comes back and it has 6 points. And so your body's going, gosh, it looks really a lot like it, but I don't know. And then all of a sudden those 6-point stars start attacking you and your body's going, wait, okay, this is a bad guy. So it develops that immune response. So what I'm saying is there's subtle changes, and that's why we get the flu year after year.
What are some of the symptoms and how can we prevent from getting sick?
Yeah, so the big thing is with colds come on very slowly. So you might, start to sneeze for a couple of days, and then, after that, you start to get a little bit of a runny nose, and then maybe 3 or 4 days later, you've got a terrible cough. That's the cold. That's a cold. Those are common colds. There's no treatments for these viral infections, and colds or viruses. Now with the flu and with COVID, you're gonna feel crummy. You're gonna start to feel crummy in the morning, and by the afternoon, you are down and out. Like it comes on and it hits you really, really fast. Usually you're gonna have a high fever. You are gonna have a cough, a sore throat, and both COVID and influenza are having the really, really bad sore throat. Body aches, fatigue, like your hair is gonna hurt. Everything just feels awful. They're also seeing with the influenza more of the gastrointestinal symptoms, so like nausea, vomiting, diarrhea. You might have some of that with those as well. And so the biggest thing you can do, of course, is get vaccinated. While I have to tell you, because I hear this every day, when patients call and they're sick, I'll say, did you test for COVID? Did you test for flu? Have you been around anybody? No, I've been vaccinated. I'm glad. I think, I am not against vaccines. You should get vaccinated. Vaccines, however, do not stop you from getting sick. So you still can get COVID and influenza. It's the hopes that you just aren't going to get it so bad that you end up in the hospital. So we do want you, of course, to get vaccinated, but you can get these illnesses. So you still need to take those precautions. You still need to wear a mask if you are at high risk during these heightened seasons. If you're going to church, going to Walmart, going out where there's going to be a lot of people, maybe to some of these outdoor events, you might have better luck because, you've got the natural air around you. But if you're going to things that are indoors, make sure if you're high risk, you wear a mask. Wash your hands. I wash my hands. The minute I leave the station, I go in my car and I use hand sanitizer, but I do that with every store, everywhere I go. And when I get home, I wash my hands. And if I am sick, I wipe down things, common areas of my house with bleach wipes and hands, to clear off any things. Also, limit your contact with people who are sick. So maybe if you're getting together for, a party, or you play cards every week, or you're, or even just work, try to, if you're sick, please stay home. I know it's hard to miss work. Even myself, if I am sick, and when I get these colds and flus, like, they knock me out. But after 3 days, I have to get a work release to prove that I was sick. And so that's when I do usually end up having to go into a clinic or somewhere.
Can you tell us about some of the antiviral medications that are available?
Yeah.
And when do you go in? When do you seek medical care?
Right. So there are a couple antiviral medications. And the big thing to know about these two is that they don't stop the illness. Like, they're not going to cure and get rid of the illness. What they do is they stop the replication in your body. So there's a protein, and it stops that virus from replicating, kind of like a big shield, So you'll still have the illness that you had before you started these, but that you're going to, it's going to stop that replication. So there's two different types. There's one that they have that's available for the influenza, and that's Tamiflu. And then there is the Paxlovid, which we see for COVID. Now, both of these, in order for them to be effective, you have to take them as soon as you start to feel symptoms. You've got to contact your doctor. And they really only recommend these for people with high risk, because they're not without their own side effects. Of course, Paxlovid is made up of two different medications. One of them is a drug that we use to treat HIV. So, it's a really strong antiviral medication. And what that one does is it helps your body, it helps stop your body from metabolizing the first medication so that it works. That's why there's two in there. But they can help it. You can get rebound illness too. So you've got to be careful. Now, when you want to seek medical help, of course, anytime you have one of these illnesses and you are having trouble breathing, or you're breathing very fast, you are feeling dehydrated, maybe you've got those GI symptoms, those nausea, vomiting, diarrhea, you just can't keep any fluids down. If you have a fever that lasts longer than 4 days, any symptoms greater than 10 days to 2 weeks, then maybe they might consider an antibiotic. This could have turned from a viral infection to a bacterial pneumonia. Cough, any type of fever, any chronic medical conditions that get worse because of these colds or flus. And just, if you have questions, feel free to call, and staff would be happy to talk with you.
Nurse Christina Paris, thank you so much for coming in and giving us some great information during the cold and flu season.
Yeah, absolutely.
We'll be right back with your morning dose of what's trending.